A very good morning, guys. I'm Dr. Sai Archana, Reader, Oral Medicine and Radiology Department, here to teach you a topic regarding the importance of forensics and its role in dentistry. So, in this topic, we are going to navigate by knowing the definition, the history, the role of forensic odontologist, why the tooth has been chosen as a vital evidence, and the clinical and radiological aids that help us identify the accused. Okay. Now, why forensics are very important is because they play a major role in identification of a suspect and help the victims. Why is the suspects and victims here is because the forensics play a major role in judicial systems. So, with the base of these evidences that are collected and which has occurred due to a man-made or a natural disaster are presented to the judicial system, thereby justice is being served. Okay, these forensics will come into play when the evidences that are presented is usually not identifiable through conventional methods such as visually looking at it or visual recognition or even fingerprints. So, the forensic odontologists are specialists who are experienced in this field to help solve the identifying crisis. Okay. The role of the forensic dentist is to extract the information from materials obtained from the living and the non-living, example in the form of saliva or in the permanent or the primary teeth, and utilize them in the identification of the unknown. Now, since I've emphasized more on forensics, what do you mean by forensics? It is got from a Latin word called before the forum, that is court of law. Okay. Kaiser Nielsen in 1970 said that it's a branch of forensic medicine which, in the interest of justice, deals with the proper handling and examination of dental evidence and proper evaluation and presentation of the dental findings. So, in a nutshell, our job is to collect the evidence, then properly evaluate it and present it to the forum in order to identify the accused and bring justice to the system. Now let's see a little bit of history. Yes, you heard it right. Forensic dentistry or forensic evidences were used in the past to identify the unknown. It has a dark twist too. I shall explain that. It is been said that in 49 AD, Nero's mistress Sabina wanted the Nero's wife, Miss Lulia Polina's head. She wanted it to be severed and brought to her in a plate. Her wish was granted, and Lulia Polina was identified with her black anterior teeth. How dark, isn't it? But in India, Rathur Raja of Kanuj, Raja Jayachandra, was recognized after his fatal death in a battle held in 1199 AD. His false teeth was the only one which helped us to identify that the Raja is dead. Sad, isn't it? There are many things and many known and unknown faces get trapped into this politics, and forensics was the only light which brought them a closure. And here is Mr. Adolf Hitler. No one would have really gone past his name, right? He was also identified after his death come suicide at the end of World War II. So all these dark things which has happened and the evidences that are brought, we have identified the unknown person. But there are two pioneers whom you should know who have contributed a significant amount in the forensic dentistry. One is Mr. Paul Revere, who was the first forensic dentist in 1770 in US because he identified the fallen soldiers using their metal bridges. The second person is Dr. Oscar Amido. Dr. Oscar Amido was called as the father of forensic odontology as he presented a paper entitled The Role of Dentist in the Identification of the Victims of the Catastrophe of the Bazar de la Châté in Paris in 1897. So don't forget these two people's name, children. So now knowing the importance of all the forensics, why should we need forensics is put in a nutshell. One is due to criminal, that is, investigation of death cannot begin until the victim has been positively identified. A closure should be given to their family members, especially when you're a couple. You have to know whether your loved one is present or have passed away. So you need to have a closure so that you can bring peace to their family members. Monetary, in cases of pensions or any life insurance tagged on to you, or you are the heir of a big inheritance, you definitely need this. So you have to bring a monetary payment. Burial, sometimes the religions, they each have unique ways of giving a burial way, right? So the Muslims give it in a different way, the Christians do it in their own way, and the Hindus burn them. So religious customs are required to give a closure to the family. And marriage, of course, you can't be stuck in your past, hence you have to move on. Again, a closure can be given to these people. And this is my reference from which I got this text. The role of forensic odontologists are very vital because they help in identifying the unknown human remains. In our case, the tooth, the jaw, and in any fillings that are present in the victim who is alive or deceased. These are being evaluated to identify the unknown person. We are also there to assist in the scene of a mass disaster and in the victim's identification. We also help them to elicit the ethnicity, like if they're belonging to a high class group or low class group, or they belong to a tribal people, or they belong to a particular set of people based on their jewelry, based on their teeth artifacts, based on the fillings they have, and based on the suits they put, or suits, or any wardrobes. So why tooth has been chosen as a vital evidence? The tooth is unique in its characters, like the size, the placement, and the shape, which helps us identify the deceased. The dental structures and the filling may be the only parts of the body that is not destroyed in extreme fire or certain mass disasters. Hence, these teeth may be used in identification of deceased individuals in accidents, any crime that happens, natural disasters, partial incinerations, and in cases of severe decompositions. This tooth has an important source of DNA in it. Okay, the dental pulp or a crushed tooth can provide nuclear or mitochondrial DNA that help us to identify a person. Now I shall give you an example based on a mass disaster. What is a mass disaster is? It means a chaotic event that has happened leading to multiple fatalities. An example would be earthquake, hurricanes, or accidental disasters due to fire, transportation, or industrial accidents. Now here is a case where there is an actual mass disaster. Have you heard of twin bombing? This is the incident. After the bombing had occurred, there was a lot of casualties. From the crime scene or the mass disaster, the bodies were recovered and they are placed on the lab. Now you can see in this picture how mutilated the face is, and the person is beyond recognition. Hence, we have radiological tools and clinical tools here to assist and identify the victim who has been dead due to this disaster. Here is an example of a case sheet where the dental findings which are brought from the mass disaster are recorded. Look how they are writing it. The clinic name is not written, but the dentist who have seen or assisted this case has written his or her name and place of examination. Then they have striken out a series of teeth indicating it as missing, and also they have shaded dark and with stripes in certain areas indicating the filling. They have also given a short form for everything, as everything cannot be written in full, there may not be much of a space, so an abbreviation like AM is given for amalgam, GI is given for gold inlay, and etc. Surfaces are also given an abbreviation. Along with that, anatomical remarks like the presence of a mandibular tolli bilaterally is also being marked. So sometimes these may serve as identification of a particular person. Now this will be compared with the antemortem radiograph and the post-mortem radiograph to come to a final interpretation of how to identify the victim. As I said before, evidence collection is the key role to play by the forensic odontologist, as the recovery of a fragmented piece of a teeth or a jaw can be got, and it will also include restorations or dental processes which is dismembered from the body. So documentation of all the evidences and safe transport of the collected information is vital. After evidence collection, you have to maintain occupational health and safety standards during examination. Then examination and recording should be followed by correct interpretation of the data collected and comparison of the data between antemortem and postmortem should be done to compare conclusive evidence. After gathering the evidence, it will be reported to the legal authority and presented in front of the judicial system, which will help conclude the identification process. We should never really go against the protocol, as it ensures safety of the individual and helps us to use, handle and store the data in the right manner for future. Now, what are the tools that are used in mass destruction? It can be in the form of X-rays like OPG, computer assisted postmortem identification system, and zero radiography. And UV rays are also used to identify tattoos and scars. Postmortem serology, that is the blood test, which will help in identification of the blood group antigen in the bone marrow of skeletal remains, and the DNA. The DNA will play a vital part, as it can be taken from the teeth, the dentures, and the appliances used by the person. Now, what are the methods that we use in forensics? We can help identify the sex of the individual, the age of the individual, the DNA present in them, chelioscopy, that is the lip prints, study of the palatal rugae, that is rogoscopy, the bite marks, and bottom profiling. Now, the evidences, as I said before, can be in the form of a bony fragment or teeth or even a skull. Now, how will you identify which gender they belong to? If you receive a skull which has a large brow ridge and a sharp neck muscle ridges developed, and they have a square chin, usually it will be a male gender. If the skull has a smaller brow ridge, more pointed chin, and a less pronounced neck muscle attachments, it will indicate to genders. And when it comes to tooth dimension, Males show greater mean mesiodistal dimension compared to the female. You can also identify the gender based on the dental pulp by if there is presence of Y chromosome and bar bodies, the gender will be determined. The teeth are best taken, then the restored teeth wherein the full pulpal tissue can be of use. Now after the gender is being known, we can identify the age. The dental structures can provide us useful indicators for identifying the age, as they have a eruption status of the teeth. Each teeth erupts in a particular time period. So by using the eruption status of the teeth, we can identify the age of the individual and also degree of their development. The age determination after the first 2 decades of life becomes difficult when the teeth is in functional occlusion. Hence, in that cases, this Gustafson methods can be followed. It will evaluate the amount of secondary dentin in the pulp chamber, the level of gum attachment around the neck of the teeth, the extent of translucent or sclerotic apical dentin. It will evaluate the amount of secondary cementum at the apex and the extent of. The age estimation can also be obtained by looking at the dentin translucency. The root dentin is considered being more translucent during the third decade of life, beginning at the apex and advancing coronally. As you can see well in this picture, the translucency gets decreased as we increase in age. So, measuring the translucency is a convenient approach to estimate the age post-mortem. And also you can use the cementum for evaluation of age. Of course, this has to be done under the microscope, especially the root part of it. It will be seen as light and dark bands and are counted on the photo with the help of image analysis software and added to the average eruption time. The age estimation is safely done in the lab. Now, as I said, you also can receive as a whole skeleton or maybe a skull alone. In that scenario, these indicators will help identify the age changes in mandible. For example, if a mental foramen is seen, if it is present near the upper border, the age group will be nearing the infant stage. If the mental foramen is present between the upper and the lower border, this is an adult as we speak. And if the mental foramen is seen near the lower border, then the patient is aged. The same applies for angle of the mandible, which will appear in an obtuse angle in an infant, perpendicular in the case of adults, and obtuse angle as we grow old. And the coronoid and the condylar process is also doing in a similar way, meaning the coronoid process is large and is above the condylar process. Then the at adult condylar process is placed above the coronoid process. In older ages, condylar process is above the coronoid process, but it is bent slightly backwards. So as we age, our skeletal parameters slightly bend backwards. You can see well in this image. As we age, the angulation of the mandible goes back and the mental foramen appears up. Now, is there any biochemical indicators of age? Yes. Amino acid racemization is one method where L-aspartic acid is used to identify the age process. How the method is, the L-aspartic acid will turn into D-aspartic acid with increase in age. Hence, racemization rate, if it's high, that means it's an older individual. Okay. The DNA in forensics is very important, as the resilient nature of the dental hard tissue to environmental assaults ensures that the teeth represents the excellent source of DNA. There are two types of DNA. One is the genomic DNA or the nuclear DNA, another one is mitochondrial DNA or the mtDNA. This is very important as it is inherited from the mother and it can be easily taken from the siblings and their maternal relatives. A wise tool when it comes to comparison and identification of the victim. A recent study found out that the mitochondrial DNA can also be sourced from dentin powder obtained via cryogenic grinding or from the dentin in the case of an RCT tooth. This comparison of DNA can be helpful in identifying an unknown individual. An antemortem sample like stored blood, hairbrush, clothing, cervical smear, or from a parent or sibling can be used for comparison of DNA. The DNA can also be taken from the saliva in from the crime scene. Examples are like the postage stamps, envelopes, glasses, cigarettes, straws, food, and chewing gum can be used as a vital source for obtaining the saliva in which the DNA can be extracted. So we can see how vital the DNA plays and how easy it can be obtained from. Now, going on to the next topic is the chelioscopy, that is the lip prints. These lip prints are as unique to one person like fingerprints. They are permanent and unchangeable. They are seen early in the human life at sixth week of intrauterine life. This lip prints vary according to the thickness and according to the races. There are three types of lips: the thin, medium, and the thick or very thick lips. The thin lips are usually seen in the European and Caucasian races, whereas the medium, which will range from 8 to 10 millimeter, are the most common type. The thick or the very thick lip is usually seen in the African American. Now, why do we have to classify all this? Is again coming to individual identification. Now, based on the lip prints, they are classified by Suzuki et al. Into five types. The type 1 is a clear cut groove running vertically across the lip. The type 1 subdivision 1 is the partial length groove of type 1. Type 2 is a branched groove. Type 3 is an intersected groove. Type 4 is a reticular pattern, and the one which cannot be identified into the other four is the other pattern, which is type 5. Now here is a proof where the lip prints is taken from a glass tumbler. Here the suspect or the accused lip print is present, which was easily traceable, which were taken up by the forensic people given for identification. When compared, the accused got caught for robbery. He had come in, broken the house, and then had a sip of this juice. And based on this lip print evidence, he was arrested and given a rightful justice. Similarly, rugoscopies can also be used as a reliable evidence in identification of a victim. The palatal loge, also called as the plica palatinae, and is useful in identifying the rugae. These rugae are not very reliable as they do not change under any given circumstances and they are permanent. Catastrophic events such as the plane crashes, fires, explosion can destroy fingerprints, but the palatal rugae will not be destroyed. Hence, this can be taken as a reliable indicator for identification of the. In this rugoscopy, a stereoscopy is a technique in which a 3D image of a palatal rugae anatomy is obtained. Based on analysis of these pictures taken with the same camera, two different points are used using a special equipment. Stereophotogrammetry is a special device, also called as the raster marker, allows for an accurate determination of the length and position of every single palatal rugae, while the overlay print of the palatal rugae in the maxillary cast is termed as calcorogoscopy. It has been suggested that there is slightly more rugae in males than in the females, and it is present more on the left side in both genders. Here are few rugae patterns that are most commonly seen. They are varying from point pattern, line pattern, curve pattern, angle, circle, sinus patterns, bifurcated, trifurcated, interrupted, and anomaly. And this is how they have been marked and compared. Now, this is how we do it digitally. We have 2 points and then we compare the points with the cast, and the computer software will help us identify whether they are the same match or not. Now we have come to the interesting part here called as the bite mark. This bite mark is defined by McDonald is a mark that is caused by teeth either alone or in combination with other mouth parts. There are various types of bite mark injuries. They can range from contusion, laceration, abrasion, avulsion, and indentation. Look how these are present on the victim, and they are always calibrated using ABFO type 2 scale. They have to be photographed initially for further reference, as certain soft tissue injuries will be gone because of the resilience of the soft tissue. Whereas in the case of a sexual mark, their bites marks may be single or multiple in the form of mild marking of the tissues to deep perforation of the epidermis and dermis. They can be found in breasts, face, abdomen, shoulder, upper extremity, buttocks, female genitalia, male genitalia, legs, ear, nose, and neck. Be extremely careful when you are identifying these signs and notify the authority as early as possible. What are the types of bite mark analysis is? For many years, we have only seen hand traced overlays, but in the recent past, the AI has helped us gain momentum. The computer generated overlays were by far the most accurate in terms of both tooth area and rotation. A common method that is used now is odontogenic triangle method. In this method, a triangle is made on the tracing of bite marks and the teeth models by marking 3 points, two on the outermost convex points of canine and one in the center of the upper central incisors. Three angles of the triangle are measured and then we analyze. First, you should analyze the bite mark on the photograph. Is this injury a bite mark? Is this bite mark clearly seen? Is it caused by human or is it caused by adult or a child? And are there any individual characteristics which are seen visually and as well as in the by using other aids like the UV rays? It has to be documented in a perfect manner, that is, the location, site, size, color, and the type of injury. Then we can enhance the quality of the image by using a computer software. Second point is we have to analyze the suspect cast and delineate the bite edges, just like how it's shown. Then the third step would be bite edges will be superimposed on the bite marks. As you can all see, a putty impression will be taken immediately after you see a bite mark and a cast will be poured. And that cast will be superimposed along on the bite mark region. If a match is got, that means that is the culprit that we are looking for. The examination of marks will lead to subsequent elimination and possible identification of the suspect as the perpetrator. So, this is very much used in the very sad condition called a child abuse. Child abuse is a non accidental trauma or a abuse inflicted on a child by a caretaker that is beyond the acceptable norm of a child care. The bite marks from adults will often one clearly marked from one arch, whereas in a child it is from both arches. They may be aggressive or sexual, the latter occasionally displaying sucking marks. Now, these are the signs of child abuse. There is physical sign, there is emotional sign, there is sexual sign, and the signs of neglect. So, what will you do when you see this? Is immediately notify the legal system and your superiors to get a perfect handling that they require. Physical signs of child abuse are unexplained burns, cuts, bruises, or welts in the shape of an object. There will be bite marks present. The child will be displaying antisocial behavior. There will be problems in school and fear of adults. That is to be noted very carefully. The emotional signs of child abuse are there is no real care, so there will be apathy, there will be total depression, the child will be alone, there will be lack of concentration, and the child will binge eat or any other eating problems. The sexual signs of child abuse are inappropriate interest or knowledge into sexual acts, nightmares and bedwetting, drastic changes in appetite, overcompliance or excessive aggression, fear of a one particular person or a family member. This is to be noted down. Then signs of neglect. The child will not be wearing proper clothing for the weather. They'll be always covering it up because the bite marks or the stab marks will be easily seen. So they'll be wearing unsuitable clothing for weather, dirty or unbathed, extreme hunger, and apparent lack of supervision. Here is one of the bite mark injury that you can see on this child's cheek. Unfortunately, it's a child abuse. You can also see a bite mark here. But we have to know the difference between a human and an animal, right? So, how will you know whether that is just human or it can also be from an animal, right? So, how to differentiate is in humans, there'll be a broad arch size and it will be usually U shaped, circular, or oval. They will have broad central incisors and a narrow laterals. The canines will be relatively small and blunt. The injury will be mostly bruising or a mild laceration can be seen, and the injury is mostly seen in breast, arm, and thigh. Whereas if this bite mark is due to animals, then the arch size will be very narrow anteriorly and there will be V shaped or elongated jaw size. The incisors will be narrow centrals and broader laterals, opposite to what we saw in humans. The canines will be longer and sharper, and the injury will be severe when compared to human. There will be severe lacerations and avulsions, and it is usually seen in the extremities, exposed skin, and sometimes not being specific. This picture shows the various bite mark injuries caused. See, here is the bite mark of a bear on an individual. Unfortunately, he had died during a fight with the bear. See how deep the lacerations are. Okay, and there is a narrow arch. So you have to know the difference between an animal bite mark and a human bite mark just to ascertain the cause of the injury or death. Now, going to the radiological aids that is used in forensic dentistry, we can use an AP view in case of mass disasters to identify injury or presence of foreign particles. Lateral skull and oblique lateral can be used, especially in an autopsy table, to find out the maxillary and the mandibular dentition for comparison of dental treatment pre-mortem and post-mortem. An occlusal radiograph can be used before a rigor mortis of the body, because after the rigor mortis has settled, it will be very difficult to open the mouth. And a CT. What is a positive identification is when the antemortem and the postmortem findings match in sufficient details without any unexplainable discrepancy to give the impression that they are from the same individual. That is the positive match. There can be a possible match when there is antemortem findings which may be consistent with the postmortem finding, but a positive identification with certainty may not be established due to the poor quality of either postmortem remains or the antemortem dental record. An insufficient evidence can be given in times where information between the antemortem and the postmortem doesn't match to come to any inference. And total exclusion can be done when the findings in the antemortem and postmortem dental records are clearly inconsistent with respect to many features to the living. Hence, I conclude by saying that dentists are of greater assistance in the detection and solving of crime and identification of human remains in the cases of crime or the calamities. All form of dental treatments should be recorded and kept properly, as it plays a real major role in forensic odontology, which will aid in judiciary system awarding judgment. These are my references. Thank you.